Good day. Today I will present the last lecture of the respiratory system, that is respiratory failure and overview. In this lecture, we will summarize and review what we have taken in the previous 10 sessions. There are three main learning objectives in this lecture. First, to identify the steps in the oxygen transport pathway from air to tissues. Second, to list the disease processes which may affect each step in the chain and the potential consequences of those effects. And finally, to differentiate type 1 from type 2 respiratory failure and to state the consequences of each. So, oxygen transport pathway and the supply of oxygen to any given tissue in the body. In order to ensure an adequate supply of oxygen, we have to have first appropriate oxygen content in the arterial blood, and second, we have to have adequate local perfusion. So we have to have good oxygen in the blood, and we have to make sure that this blood is going to go to the peripheral tissue in order to ensure good oxygenation and to avoid hypoxia. So let's remind you about the structure of the lung, the basic structure of the lung. You know, in the lung, we have this one, which is as you can see here, the terminal bronchiole. The terminal bronchiole will end up into respiratory bronchiole and then alveolar duct, and finally it will end up with this alveolar sac that contains many alveoli. And this alveolar sac, where the oxygen is surrounded by a network of pulmonary capillaries. So the oxygen will be freely diffused from the alveoli into the blood of the pulmonary capillaries. And there is elastic fiber. The elastic fibers keep the alveoli open all the time. And as you know, there are two types of blood vessels or pulmonary capillaries. We have the blue one is the respiratory arteriole, which carries deoxygenated blood from the heart to the alveoli, and we have the red color pulmonary venule, which carries oxygenated blood from the alveoli to the heart. So in order to ensure that there is a good oxygen transport, we have to follow the oxygen transport pathway. First of all, we have oxygen supply. Oxygen supply depends on the presence, oxygen supply to the tissue, of course, depends on the presence of oxygen in the artery. There should be adequate oxygen in the artery. And this oxygen in the artery depends on the partial pressure of oxygen in the alveoli and the oxygen diffusion from alveoli to capillary. And the oxygen diffusion from alveoli to capillary depend on adequate ventilation. So if there is good ventilation, there will be good oxygen diffusion from alveoli to the capillaries. And adequate ventilation depends on the ease of airflow through the bronchi and bronchioles, and it depends on the breathing movement capacity of the lungs, and depends on the air composition itself, how much oxygen is there in the air. So let's start talking about adequate perfusion. We said that oxygen supply to the tissue depends on the adequate a presence of adequate amount of oxygen in the artery, and the presence of adequate perfusion, a good blood supply to the tissue. So hypoxia due to poor perfusion depends on the following two factors. First of all, local, and second is global perfusion. So the local perfusion, if there is defect in the local perfusion, means there is arterial insufficiency. For example, in peripheral arterial disease due to atheroma or advanced atherosclerotic vascular disease, there is narrowing of the blood vessel, so little amount of blood is reaching to the organ or to the periphery, for example, the feet. In this situation, the patient will suffer from what is called claudication, which means the patient, when walk for a short distance, he or she will feel severe pain in the leg, usually in the calf area. And at that moment, the patient will stop and take a rest for a few seconds or minutes, and then resume walking, and then stop, and then walking, and so on. This is called intermittent claudication, which is a feature of peripheral arterial disease or atheroma. Other signs of peripheral arterial disease include loss of hair, because the hair follicle will die due to lack of blood supply, and there might be ulcer in the advanced disease, and the ulcer is characteristic of peripheral arterial disease, like in people with diabetes. While arterial insufficiency in the coronary arteries of the heart will result in what is called angina pectoris, and the patient will have severe chest pain on mild exertion. This is local poor perfusion. What about global poor perfusion? Global means there is a low blood pressure or there is low blood volume. So there is little blood goes to the tissue. And this situation is called shock. And you have heard about the term shock. So it's either due to hypotension, so the blood is not going to the tissues because of low blood pressure, and this will result into a certain body response. The brain will give instructions to keep the blood supply to the important organs, that is the heart and the brain. And the blood will be diverted. The direction of the blood will be converted from the peripheral tissues to the brain and to the heart. Therefore, the patient will have cold extremities. And if hypotension persists for a long period of time, this will be very harmful and might result in the death of tissue. Now let's talk about oxygen in the artery. We talked about adequate perfusion. Now we should talk about adequate oxygen in the artery. Okay. So hypoxia due to poor oxygen content in the arterial blood may be due to either low oxygen carrying capacity of the blood itself or due to low partial pressure of oxygen. So low oxygen carrying capacity of the blood is either due to anemia, low hemoglobin, because you know hemoglobin is the major carrier of oxygen in the blood, or because there is another substance that competes with oxygen to be carried by the hemoglobin. like in carbon monoxide poisoning. Carbon monoxide has a greater affinity to hemoglobin than oxygen, so there will be little amount of oxygen carried out by the blood. Anemia is either due to a problem with the manufacturer of hemoglobin, that is the red blood cells, that is the bone marrow. So any bone marrow disease like myelofibrosis, there is there will be anemia, or it is due to deficiency of iron, because iron is important for the synthesis of hemoglobin, or B12 deficiency, or it is due to bleeding and loss of blood, or red blood cell destruction, for example, by in the case of hemolytic anemia, such as sickle cell anemia, and in the case of G6PD deficiency, for example. So, on the other hand, poor arterial oxygen content may be due to low partial pressure of oxygen. So the blood is okay, but the partial pressure of oxygen is low. And this results either from low oxygen in the alveolar gas, that is a problem with the air, contains low oxygen, for example, in the case of a high altitude, people who are living in the mountain, or it is due to impaired transport of oxygen through the alveoli into the blood vessel. And here we have two major categories. Either it is due to poor ventilation perfusion matching, or what is called ventilation perfusion mismatch. And this is due to either pulmonary emboli, so there is emboli or thrombi that is occluding the pulmonary arteries, or it's due to pneumonia. So there is blood, but there is no effective perfusion of oxygen, diffusion of oxygen, sorry, because of the loss of function of the alveoli because of pneumonia, or because of collapse of the lung. All of these three conditions will result in ventilation perfusion mismatch. While the second cause is unusual barrier to diffusion, so there is good ventilation, good perfusion, but there is a barrier between the alveoli and the blood vessel. Example, in the case of fibrosis, lung fibrosis, there will be a fibrosis surrounding the alveoli, preventing oxygen from being diffused into the blood vessel, or heart failure. In heart failure, or malnutrition, or liver failure, all of these three conditions, there will be edema, pulmonary edema, and the fluid will surround the alveoli and even fill the alveoli sometimes, avoiding the free perfusion or diffusion of oxygen into the blood vessels. Okay, now there are two types of respiratory failure, as you know. We have type 1 respiratory failure and type 2 respiratory failure. In type 1, the problem usually is with the exchange of oxygen between alveolar gas and pulmonary capillary. So there is good oxygen content in the alveoli, but the problem is in the exchange. There is a problem in the exchange. This will result in the following. First of all, oxygen will be low, the partial pressure of oxygen will be low in the blood, but there will be normal or low partial pressure of CO2. Why is that? Because CO2 is a freely movable and the exchange is not affected between the alveoli and the arteries. So we have either normal or low CO2, but with low PO2. This is type 1 respiratory failure. In type 2 respiratory failure, there is a problem with the ventilation of the alveoli. So the oxygen is not reaching the alveoli for one reason or another. So there will be accumulation of PCO2. Why is that? Because there is no washout of CO2 from the alveoli because of a problem with the ventilation. So as a result, there will be low partial pressure of oxygen with high partial pressure of CO2. And if we return back to the scheme, so what are the causes of inadequate ventilation? So poor ventilation is either due to difficulty in movement of air through the airways, for example, in obstructive lung disease, in late stages of asthma or COPD, the movement of air through the airways because of bronchoconstriction is difficult, or it's due to difficulty in expansion of the lung. For example, we have a stiff lung, loss of flexibility, loss of elasticity of the lung, or when there is deformed chest, somebody might have kyphosis, scoliosis, or certain deformity of the chest that affect the movement of the chest, or there is a problem with the muscles. Muscles of respiration are weak due to either, for example, myasthenia gravis or motor neuron disease. And finally, we talk about the air composition. So any one of the above factors affected, it will affect the oxygen supply and to the tissue and will result in hypoxia. So regarding airway composition, it is abbreviated by those who are living in the mountains. So they are living in high altitude and there is inappropriate inspired gas. So oxygen supply is very low at the level of the air itself. And therefore, the amount of oxygen reaching to the blood is low as well. And then if somebody goes to the mountains, during the first few days, he will suffer from shortness of breath, but then after he will have what is called acclimatization. And by acclimatization, we mean he will use to very low oxygen in the air by certain mechanisms. The body will start to produce hemoglobin in large amount in order to compensate for the low oxygen in the air. As a result of that, they will have what is called polycythemia, a very high hemoglobin percentage in their blood in order to carry oxygen adequately to the tissue. And thank you.